Hello, my name is Rob, owner of Stretch Therapy Vancouver. I specialize in PNF stretching for the treatment of muscle imbalances. Now, we have two types of muscle imbalances. We have a tightness imbalance and a weakness imbalance. Now, by definition, if one muscle is tight, the opposite muscle is weak. It's a lax muscle. Now, our joints are out of balance, out of neutral position. The muscles aren't stabilizing in neutral position. So there's a two-step approach to treating the joint for long-term success. One, we need to stretch the tight muscle. Two, we need to strengthen the opposite muscle, the weak muscle. So now all the muscles are working together evenly to balance that joint in neutral. The joint we're going to talk about today is our shoulders. As society, spend a lot of time in this position. If these muscles are tight, our pecs, anterior deltoid, and our upper trap is tight, it causes upper cross syndrome. We don't want that. So we're going to stretch out the muscles here in the front of the shoulders. Then we're going to strengthen the opposite muscles, the rear delts, and we're trying not to stimulate the trapezius because that leads to upper cross syndrome. So what we're going to do today is start by stretching the front of the shoulders, and we're going to use the wall. Now, if you've done my classes before, we've done a similar stretch against the floor. On the floor, we can roll and get a nice back stretch, but I do this more often. I do this in between clients or from waiting. Often we can't just roll around on the floor. So this is a great alternative. Now we don't get that nice rotational back stretch, but we get a more powerful stretch to the front of the shoulders. Now, the main principle we use in PNF stretching is the contract relax technique. Now, if the contract relax technique doesn't make sense to you right now, you can just practice a hold relax technique. Just holding that stretch for 30 seconds to a minute and then switching sides and sometimes coming back to that. Now, the contract relax technique is only recommended once or twice a week. It is a stressor on our central nervous system, and so we need more time for rest, recovery, and adaptation. That's the important part, that we adapt and improve. So find a therapeutic dose for you. Of course, you can always contact me to help and get the best results. Now, the contract relax, we're thinking about targeting the muscles in the front of the shoulder. An ideal contraction is about 6 seconds, and it's an isometric contraction, meaning without movement. We'll be using the wall. So now our arms can't move. So we're going to think about pushing our hands to the wall. We're going to think about rotating in and pushing the thumb side of the hand to the wall. That'll be for the bicep. When we're done our contractions, we're going to relax our hand to neutral, palm to the wall. So let's watch this, and then you can practice at home. So to stretch the left side, I'm going to face the wall. I'm going to high five the wall, hand at shoulder height. I'm not shrugging that shoulder up. I'm keeping that shoulder down. I'm touching the front of the shoulder to the wall. And then from there, I'm stepping in the opposite direction. I'm in a split squat stance. You probably can't see my feet. And I'm just leaning against the wall. Our first contraction, of course, on that target hand, in this case, my left hand, is for our push up muscles. So I'm going to push my hand to the wall gently, continuously, and breathe normal. So I'm going to push my hands to the wall as I count down from 5, always breathing, 4, 3, 2, and 1. No more pressing to the wall. I'm relaxing that hand, wheel the fingers. Now I'm going to squeeze my shoulder blades together to increase the stretch to the front of the shoulder. I'm going to practice that again. I'm going to push my hands to the wall from 5, 4, 3, 2, and 1. Big exhale. I'm going to squeeze my shoulder blades. Now, don't let your armpit come from the wall. We don't want to do this. No, there's no stretch to the shoulder. It's a stretch to the wrist. So keep that armpit to the wall. Okay, the bicep does stabilize the shoulder. So I'm going to now rotate my hand forward. So my palm is off the wall and the thumb side of the hand's to the wall. Can you see how my palm's off the wall? Now I'm going to push the inside of the elbow flat to the wall. So I'm pushing the inside of the elbow flat to the wall. 5, 4, 3, 2, and 1. Big exhale. I can relax my hands so long and stand up nice and tall. I'm going to squeeze the shoulder blades together. Let's practice that one more time. Rotating the hand forward so the thumb side of the hand is so long. And push the thumb side of the hand inside the elbow flat to the wall from 5, 4, 3, 2, and 1. Big exhale. Relax the palms. Stand tall. Like I said earlier, if those contractions aren't making sense right now, just enjoy this position. And we're trying to identify, are one of these hand positions more challenging than the other? If it is, I recommend focusing more on that position. Once that muscle releases, we can reassess. When we're all done, we can turn into the wall, we can slide that down, and we can shake out the hands. Now we're stretching these muscles in here. If those muscles are tight, it pinches on the artery and restricts blood flow to the distal end. So you might feel your hand, there's little pins and needles in your hand. That's okay. Once you disengage and wiggle the fingers, you'll be fine. That's just an indication that these muscles are tight. So let's practice that same technique on the other side. We're gonna face the wall, other hand up. We're gonna high five the wall. I'm gonna roll the shoulder to the wall. I'm gonna rotate in the opposite direction. Nice wide stance. I'm leaning against the wall for balance. Remember our first contraction for our push-up muscles. So that arm that's in stretch, I'm gonna push my hands to the wall very gently as I breathe from 5, 4, 3, 2, and 1. No more pushing to the wall. I'm relaxing the hand. I can wiggle those fingers. And you said it nice. So I'm gonna squeeze the shoulder blades together. So I'm using the opposite muscles to the pec, and that's gonna be the mid trapezius. Let's practice that again, gently pressing the hand, the elbow, the shoulder to the wall, a wee bit harder as we breathe from 5, 4, 3, 2, and 1. No more tension. Relaxing the head, squeezing the shoulder blades. Again, keep that shoulder to the wall. Don't let that shoulder come off the wall. Okay, let's see how our biceps are doing. So that arm that's against the wall, I'm going to rotate the hand forward so the palm is off the wall. I'm going to push the thumb side of the hand inside the elbow flat to the wall. Always breathing. Count you down from 5, 4, 3, 2, and 1. Big exhale, relaxing the palm to the wall. I'm standing up nice and tall. I'm squeezing my shoulder blades together. Oh, enjoying that stretch to the front of the shoulder. Feels great. Practice that one more time. Rotate the hand forward, push the inside of the elbow to the wall as we breathe from 5, 4, 3, 2, and 1. Big exhale. Relax the palm. Squeeze the shoulders. Enjoy that stretch to the front of, in this case, my right shoulder. When we're all done, we can turn in, we can slide that hand down, we can shake it out, we can reset the shoulders. Great. So we stretched out our pec, anterior deltoid, and bicep. Now, what's the opposite muscle to these? The rear deltoid. Now, based on a recent EMG study I've seen, this movement is called the lever pull. It's the best way to target the rear deltoid without engaging the trapezius so much, without exciting that muscle so much. Now, I'm going to demonstrate the movement, and then you can practice with dumbbells. Now, if you have any back issues, you might want to, if you're at the gym, you have an incline bench, we can just lay face down on the incline bench. I call it the surfboard position. So what we're going to do, I'll go to the side so you can see me. I'm going to place my hands to the side, palms facing behind me. Now, from here, I'm going to hinge at the hip. Now, watch out the shoulders don't come forward. We want those shoulders back. Now from here, I'm going to push my palms up towards the ceiling. So I'm squeezing, pulling the arms back and let those arms come down. Again, don't let the shoulders come together in that bear hug position. Keep those shoulder apart. So going up, squeeze, and then resist down. We're not going to this candy cane position. That usually means your hamstrings are tight. There's another video for that. So keep the hips back, shoulders back. Now I'm going to practice that with some dumbbells. I'm standing up nice and tall. I'm hinging at the hip. Chest up, abs tight, palms facing the ceiling, very important. I'm going to bring those palms up to the ceiling. I'm going to exhale and then resist coming down. Up, squeeze, breathe, and down. So you'll have to find a weight that's right for you. Up, exhale. And we probably want around the 12 rep range. Now, if you're able to do 15 repetitions or more, that weight's way too light. The key is control on the way down. We don't want to just bring it up and then drop down. Nope, bring that back, resist, stretch down. So I'm engaging in my rear deltoids to bring the arm up, and I'm stretching those muscles down. Up, squeeze, and down. And like I mentioned earlier, if you have an incline bench at the gym, one of those adjustable benches at a 45-degree angle, you can go face down on the bench so that way your back is supported. And once you're done your desired rep range at the right weight, we can drop those weights and we can reset. Now, the stretching part is easy. I'm really good at that. The strengthening part does take a little bit more time. It generally takes, 4 to 6 weeks for these muscles to get stronger. If you've gone to the gym, you know that it takes a little bit of time. Our stretches, most people adapt in just a few weeks. The strengthening portion takes a little bit longer. Both locations I use to help my clients both have access to fitness equipment. So we can stretch, we can strengthen, we can do one or the other or both or whatever you need. If you have any questions, please let me know. Have a great day.